Well, we've got a couple great guests on right now, one of which you know, she was here yesterday. We can't get rid of her this week, but we're glad to have her again. Shirley Witt from,
morning.
of course, Florence Sylvester Senior Center. It's great to have you here.
Thank you. It's good to be back.
And you've been telling us you were going to bring on this gentleman, Dr. William Schenkel, who is the medical director of the Schenkel Clinic and this is a long one, the Judy and Richard Valtmer Chair in Memory and Cognitive Disorders, Hoag Neurosciences Institute. Welcome.
You passed.
Yes, I passed. I know you've been on here before a while
Yes,
back,
yes.
so it's good to have you here again.
Thank you.
And we are talking about something that Age Well and Florence Sylvester has been doing through the month of October, and also a couple more sessions going on November 19th and December 17th, maintaining your brain health.
Right.
And we have talked about this
We've
many
talked about
times.
this before, and as you know, and most of the people know in the community, that the Florence Sylvester is a great resource for the seniors of this community. And you know, we kind of do that because of what the seniors want. And the seniors want to remain healthy, live longer, and they need to do that through education, and that's one of the things that we do at the senior centers. We try to educate people. And physical fitness is very important, but mental fitness is at the top of the food chain right now.
Sure.
And our seniors are demanding programs on that. So we have partnered with Hoag and Dr. Schenkel and have brought in some very, very good programs and have been very well received in the community. And we continue to do this partnership in the future, and Dr. Schenkel is going to talk a little bit about what this program is and how it helps. And he's wonderful, and it gives us some kind of relief that there's things that we can do to keep our brain healthy and our memory, you know, at a great
top
I'm losing
top
my memory.
Doctor, this is obviously, I think over the past, maybe, wouldn't you say maybe about the 10 years, 10 or 12 years, this has become even more of an important topic, maybe because of the medical community, the studies that have been done that are able to pinpoint things quicker than maybe what they were years ago. What is the main focus of the Keeping Your Brain Healthy, this brain aging program? Wonderful website, by the way, ocbrain.org.
Thank you. So the key focus of the Vital Brain Aging program is to apply what we call population science to the community. And to do that, we need to educate both the physicians and the public about the science of preventing cognitive impairment and dementia, whether it's due to Alzheimer's disease or some other cause. Okay. For example, we know that only 45% of all causes of cognitive impairment and dementia are due to Alzheimer's. That means 55% are not.
Interesting.
Yeah. And most of those are easily treatable if you catch them early. But if you let it go, it's like if you have diabetes is treatable.
Right.
Right? But if you start going blind with diabetes, you can't reverse that.
Right.
The same's true with the brain. So we've got lots and lots of treatable causes of memory loss and cognitive impairment that tend to go unrecognized or undetected until it's very late. And then you can stop it at that point, but I think I'd rather have it stop before I even know I have a memory problem.
Right.
As opposed to, having some trouble paying my bills because of a memory problem.
What are some of these other causes that, we normally hear Alzheimer, dementia, something like that? What are some of the other causes?
Well, the second most common cause is blood vessel flow, blood flow to the brain, what we call cerebro-brain vascular disease, so blood vessel in brain. And that you can identify and stop its progression. So again, I'd rather stop it before I have any symptoms. And the Vital Brain Aging program provides a very simple 10-15 minute assessment that can pick up a memory problem 20 years before the onset of dementia.
Interesting.
Now, most people, the studies show that most people will not even be aware that they have a memory problem when it's detected. And that's just like diabetes. You get a blood test, and oh, your blood sugar's elevated. Oh, so you got diabetes. Oh, so we give you a little treatment, and you never develop symptoms.
Yeah.
Okay, so we can manage it. Same thing is true for even for Alzheimer's disease. We can delay the progression by 50 to 60% with the existing medication. So if we put this all into perspective, we can delay the onset and the progression of memory loss to the point of becoming demented by 22 years.
Which is so key. It means that it may go beyond someone's lifespan.
Right.
So they may never.
That's right.
They may never. What are the things that you look for and test for? And is this what you folks are doing here
Yes.
on November 19th and 17th, and at the Senior Center? I want to mention it's a cost of $45.
Right.
So what are some of the things you do? Is it you have them do a written test and
Well-
crossword puzzle, which I would fail. That would be
Yeah,
it right
yeah.
there.
Fail too.
That would be the end.
Yeah. Well, we looked at all of the tests that are out there as a program, and we asked the question, which test is brief but is very, very accurate at detecting the earliest changes in cognition that are due to some non-aging related condition. Could
Okay.
be any chronic disease will cause cognitive impairment. Heart, lung, kidney, you name it. And this test is a test of memory, so you have to learn a 10-word list, and then there's a delay, and then you have to recall it. So it's very simple, okay? And yet we have published that there are 3 separate validation studies to show that it's 97% accurate
Wow.
at separating normal aging-related changes in memory from changes in memory due to a medical condition. And you were wondering about some of the causes. Again, every chronic medical condition can cause cognitive impairment. Pain. I had a patient who was demented because of pain.
Wow.
And when I treated the pain, the dementia went away. Okay. Pain is very common among the elderly. Okay. Heart disease, very common, causes cognitive impairment if it's not well managed. Diabetes causes cognitive impairment. High blood pressure causes cognitive impairment. Thyroid conditions cause cognitive impairment. And all of those are treatable. But again, what we want to tell the public is really that you get your blood sugar checked, you get your blood pressure checked. The most important thing you have is this thing.
Right, yeah.
Right? You need to check it after 50 years old. And I think a few of the people at Laguna Woods qualify. Is that
Yes.
right?
A couple,
Yes,
couple of them.
I would qualify.
Yeah.
You know, what you're saying makes perfect sense, because even if we're in fairly good health, we know that if you get a cold, if you get the flu, especially with a fever, or if maybe your back hurts for a couple weeks, you're not thinking quite the same way. Your
Right.
mind is focused on that, so you might forget temporarily simple things that you should do. And you go to the store and you go, oh, what was I supposed to get today?
Exactly.
Oh, my back is killing me, and that makes perfect sense, doesn't it?
Well, we're excited about it because a lot of the staff members have taken the test. My test is coming up in the near future. And some of the seniors have come back and said it's a very simple test. But what they're excited about is you go and see your doctor once a year for a physical. This test will be the basis. You will go back next year for another test and see how far along you are, or if there's any changes. And that way, there's a baseline. And so it's the same for your brain. So we're really, really excited to bring this program to this community. I think it's innovative, and it's necessary, and it's going to be a great success.
Doctor, is your hope that, as Shirley says, people who are fairly good health, they go to the doctor maybe once a year, that after a certain age, this should be a part of the routine when they go see their physician.
That's right. That's right. We want to institute the annual memory checkup after 50 years old. And in California alone, we can reduce the cost of dementia by $10 billion a year just by
Wow.
an annual memory checkup.
Well, that's certainly worth it.
Yeah.
And I can see that the importance of this for everyone, because you worry about things like that, and especially now, as we talked about at the beginning, they meaning your community is able to diagnose these problems so much better than what they used to.
Yeah, we don't. We understand what Alzheimer's is, like we understand what diabetes is and what blood pressure. This is a disease that is due to molecules. Certain molecules accumulate in the brain and cause brain dysfunction. And that brain dysfunction is called cognitive impairment or functional impairment. And by taking a strategy of identifying risk factors and managing them and choosing a healthy lifestyle, you reduce the production of the molecules that cause Alzheimer's disease. And so over a long period of time, if you're continually managing your medical conditions and doing the cognitive and physical exercise and the diet, then you're continuing to reduce the production of the molecules that cause Alzheimer's, and it keeps delaying when it actually would appear. And by doing that, you can actually delay the progression by 15 years.
That's incredible.
It's really
It
incredible.
is.
And this is not just hearsay. One of my patients was an identical twin, and she had a little bit of trouble remembering recent conversations. Okay, well, I asked her, "Where's your twin?" Well, she's in a nursing home, incontinent, wheelchair bound, and with a feeding tube in her, and she has Alzheimer's. And the difference in their rate of progression is 15 years. And the reason for that difference is that the healthy one, she exercised, dieted, continued lifelong learning, managed her medical conditions, and the other one didn't.
Wow.
15 years.
Yeah, huge difference. It really is.
It's an unbelievable difference. So you could, change your life like that.
You can. I want to ask you one more question. The difference between dementia and Alzheimer's.
Yeah, that's a commonly misunderstood difference. And it's if I were to draw an analogy, Alzheimer's is like the Los Angeles Lakers, and dementia is like the NBA. I mean, not.
Yeah. No, that's.
Well, yeah, but dementia is literally how severe something is.
Okay.
And Alzheimer's is a particular disease that causes dementia, or it causes mild cognitive impairment. So you got severity level, no symptoms, mild cognitive impairment, dementia.
Okay.
So it's a severity measure, and at dementia level, you could have Alzheimer's causing it, you could have stroke causing it, you could have
Okay.
pain causing it.
Okay. Very good. Well, this is a fantastic research and program that you're doing here.
Thank you.
And for those that are interested, the two dates, November 19th and December 17th at Florence Sylvester. And I'm going to give you the the one number on the website to go to. The website, very easy, ocbrain.org, and the number is 949-764-6288. If you forget that, and we all forget numbers, let's face it, call Shirley. Just call the senior center. They'll give you this information.
And you do have to make a reservation.
You do.
And we are, these dates may be filling up very quickly, so we are going to be opening up some more dates. So
Very good.
Somebody will call you back and get you scheduled, even if it is in December or January or February. We will get you scheduled into the senior center.
All right, and head to the website. A lot of good information.
Right.
Dr. Schenkel, thank you. It's been
My
a pleasure.
pleasure.
Nice
My
to have
pleasure.
you on today. Nice to see you again.
Nice
We'll
to
see you in
see
a
you
couple weeks.
too.
We'll be back in just a moment.